I'll mention I'm a University of Missouri graduate of 1987, so I've been practicing for 30 years. The part that I want to stress the most right now, though, is that I'm a general practitioner just like the rest of you that are joining us today. I do have those special certifications, but my practice currently is running only as a general practice. I am not running as a referral practice, so I think that's really important to understand these concepts, because what I want to show you is how I, as a general practitioner, have been able to incorporate this method of medications or medicine into my practice. Well, I represent the 2.5 full-time equivalent veterinary practices across the United States. We have 2,400 active clients, 11,000 invoices per year. Our average transaction is $145, and just now we saw that we broke the $1.6 million in gross receipts. Do I give this to you in any way to brag? No, I don't, because I don't even know where you stand on this. I give it to you to understand that this is doable in these small practices. My location is not all that great. In fact, the location that I'm in, my practice is a 90-year-old practice. Our phone number dates back that long, so this is the original practice in Liberty, Missouri. Now, Liberty is a suburb of Kansas City. Its population is 30,000. We've had less than 20 new houses within a 3-mile radius of my clinic. We have a median household income here of $65,000. Our median house price is $184,000. And don't believe that there's not any competition here. We have 6 vet clinics and 12 veterinarians that are represented here, and we're sitting right in the middle of the country. So nothing real special, but it's a great place to live for us. So after 30 years of practicing for me, 27 of those years I had never tapped a joint. So really one of my main points is I don't want you to be afraid of what we're trying to offer and to bring to your practices today. The fact is your practice needs this, just like my practice needs this. I'm getting beat up every day. I've already signed off today on 5 different pet meds prescriptions. So the internet is really robbing our practices of our potential income, making it hard for us to be general practitioners. The humane societies have taken away my spays and neuters. I now do the same number of spays in 1 month that I used to do in 1 day. And I think a lot of you are feeling that same thing. And then, of course, we continue, and I think some of the new generation out there perhaps continues to just give away more and more of our business to the corporate referral practices. Now, I have nothing against referral practices, but as I hope to show you today, these are things that you should be retaining in your own practices rather than by referring them. Why give up another revenue stream to one of these 3 bodies here? So how do we compete against this? Number 1, we do treatments that can't be done online, and that's what we're going to study today. We're going to do procedures that are not done by the humane societies. And here, importantly, I think, is we're going to do easy, and I'm going to prove to you how easy it is. We're going to do easy, high volume, and that's the reality. This is not a low volume procedure, but we're going to do these high volume procedures in our hospitals rather than refer these out to somebody else. Here's Cole and here's Charles. These are 2 cases for mine. Here's their radiographs of their elbows. Cole on the left, Charles on the right. Obviously, very, very bad elbows on both of these dogs. So Charles was presented to me before I had regenerative medicine or PRP available to me, and this was one of my common protocols for a problem such as this. Charles ended up on carprofen, Dasequin, gabapentin, and Adequan injections. Much to my chagrin, after the first supply of those medicines that we supplied him with, they started refilling all of those medications on the internet. So that client, unfortunately, still complained about the cost, and Charles still continued to limp on that left front leg. Over an 8-month period, that owner spent $2,400 on those pain medications, And sadly, only $300 of that was at my practice. And most sadly, Charles was then euthanized at that point due to the cost and due to the poor result. The flip of that is Cole, the black lab. I had regenerative medicine available for him and followed that protocol. So Cole got PRP, elbow injections, every 6 months. He regained 30 degrees of range of motion after a 2-week period. He's doing well after 18 months. Now, since he's been doing so well, that owner has gone ahead and done a cardiac workup for an arrhythmia, a splenectomy, and he's been treated for prostatitis. That client spent $1,800 on elbow treatments and has since spent $6,000 on other services at my clinic. So the conclusion is, in the one example, the PRP, $1,800 stayed in my clinic, plus, of course, the other part, versus only $300 on the previous case for drugs. And we've got a live versus dead dog, and I haven't even factored in the benefit that we've gotten from the increase in radiographs and workups that we do on these dogs that are now necessary compared to just dispensing drugs. And we'll learn more of this in just a few minutes. So drugs versus regenerative therapy. When we just treat with drugs, we're not getting a specific diagnosis. So in practice, you're missing out on some good diagnostic tools and the income that we derive from that. You end up treating the whole patient when you do that. And honestly, we all know that it's just a Band-Aid. You're not solving anything. And more importantly, when you put them on drugs, you're preventing better therapy. You're actually keeping them from actually seeking out better therapy. Then, of course, we're all very familiar. You have the side effects, both the side effects on the patient, and now, as I presented, the side effects on your practice, that they go then and buy it on the internet. So that's having horrible side effects. And the fact is the cost per month is actually the same, or eventually ends up being less with regenerative medicine as it does versus drugs. So with regenerative medicine, we get a specific diagnosis. We treat only the problem area. We're actually allowing for repair and regeneration. We're getting better results. There's minimal side effects, and the cost per month actually average out the same, again, if not less. But just 3 years ago, my practice was just doing $900,000 in gross revenues a year. Now we're at that 1.6. This is not all a result of regenerative medicine, but regenerative medicine is a big part of that. And the whole concept of keeping these procedures internet proof and keeping them in our practices is what's driving this home. We're just offering things to clients. We're not getting more clients. My area is not growing rapidly. We are not taking clients away from other veterinarians. We are simply offering them a more opportunity besides drugs that can be taken away and taken onto the internet. So the fact is, this is a win-win-win situation. Most importantly to me, the patient here gets better care. That is always my first criteria, is that the patient gets better care. Number two is the client gets a better option for virtually the same cost. In my practice, we currently do the PRP for $600 an injection and $600 a treatment. I will treat 1 to 4 joints with that cost. That does include our sedative cost with that. These are very easy. All it requires is we give virtually 100% of these animals get a dexadomator with a torbigesic IV pre-med, and with that sedation, we're able to do that joint injection. I did 4 joint injections just this week in under 45 minutes. was the time that we spent on that. And very, very important to my practice is that this creates a new revenue stream through the increased diagnostics and through keeping these procedures in my office, not allowing them to go to the internet, and certainly not referring these cases. You know, in my opinion, referrals should be low volume cases that require extremely specialized or expensive equipment. This is not a low volume procedure, and it does not require expensive equipment. This is something that we're all capable of, and you're seeing these patients every single day in your practice and all. We currently have a goal that we will be treating one of these a day at minimum and everything, and that's our goal, and we're heading towards that.